Hey, Don here. Welcome to Podiatry Practice Mastery, where I try to help you take your practice from starting out to 1 million. That's my whole goal with this. So I've been talking recently about my MVP, which are the most valued patients. I'm going to talk about that today. I'm also going to talk about someone asked me a question about holiday gifts. What do I do end of the year? What do we do for holiday? And I'll talk a little bit about our holiday party that we had in our office. Okay, so first of all, I guess we'll start with the fun stuff. Holiday party. We recently had a holiday party. We went to this place called Schoolyard. It's nearby our office here in Worcester. We brought all the staff there. This was on a Tuesday. We worked half day. We brought all the staff there. Got kind of food, and we could play games. So we played kickball, which was fun. And we played dodgeball, which I probably shouldn't have played. I was a little aggressive, so we had two people. We had one of our staff. She has kind of hypermobility. She came in a knee brace the next day, and then I came in like limping in the next day because I hurt my knee from playing dodgeball, and I also got a Dr. Sabby. It kind of threw a ball right to my face. But we had fun, holiday party. We all had Yankee swaps. We all brought kind of a gift, about $25, and we exchanged it with one another. I ended up getting some multicolored pasta, which was the worst. And I thought I was going to bring the best gift. I got one of these new vibrating toothbrushes for my kids on Amazon, and I love the thing because now it like turns off every 30 seconds. They probably all do this. I just didn't know this, and but it was like $25, and then and a fanny pack because everyone's liking fanny packs. That's what I got, and the other gifts were kind of nice since it's mostly females. Like the gifts that were most popular were like the fluffy slippers and the creams and stuff like that. But it was a nice thing. And then everyone asked me, "What do you do for holiday gifts?" What we tend to do for our staff, just to keep it, because they're going to talk to each other. We give bonuses based on like a week's worth of salary. So what they would normally earn. So if they're full-time week amount. If they're part-time, whatever that part-time week equivalent is. So that is the answer to the holiday party question. That's kind of what we do for our gifts. Patient MVP, patient of the day, was a 71-year-old female. She came in with right foot pain. In the plantar plate region. She had been seen by another doctor, and they gave her a Boudin splint, which is the same thing I start with, like a Boudin splint to pull it down. She had a metatarsal pad in her shoe, and that was about it. They had x-rays, and they said she had a bunion and hammer toe, as we all know. So what did I do for her? A little bit different as a second opinion. When you come in as the second person around, it's a little bit easier than the first person around. What I did, first of all, I got new x-rays. We looked at, she has that dislocated second digit. She has the bunion. And then what I did, she has like a positive Lockman, so pain. And what I really think helps the most from my hands is doing my forefoot pain presentation. So if you haven't looked at that yet, I'll put a little link to it here. And so it's a slide. The first slide just talks about forefoot pain, talks about all the different causes. And I focus mostly on the plantar plate, how there's a little bit of a tear, and how it's white and it doesn't have the best blood flow. So it kind of focuses on increasing blood flow to the area with shockwave. That's my whole focus on this because she's done the other stuff prior. And the conversation then was, well, how do we treat it? How do we determine if it's really bad? I do that with an ultrasound. So we got an ultrasound. It did show that the flexor tendon was normal, and then that deep to it where the plantar plate inserts, there was a little bit of a bony kind of a prominence, and I showed her that on the x-ray, correlated it to the ultrasound, and I showed where there's a defect or an effusion in the area where that plantar plate is. So how do we treat it? I gave her options, surgical and non-surgical options. Surgery would be, fixing the hammer toe and possibly plantar plate with the bunion, but then the non-surgical option would be the shockwave. So I recommended for her 3 sessions of shockwave, and then at the second session doing an amnio injection with ultrasound guidance right in that area and putting her under a cam boot for a week. And then the other option would be surgery. The challenge with surgery these days, though, is, I don't know about you, but we're like scheduling out about 6 months to get surgical block time. It's not too easy. And also, it's a surgery. It's the right foot. You're going to be 6 weeks in a walking boot, things like that. So for her, it might be a better non-surgical option. So what I do is I write this on my little treatment sheet that I give them. And then I kind of write the prices on the treatment sheet as well, so they know, because they're going to be thinking about it. So by EPAT, I wrote $750 because it's 3 sessions at $250 a piece. to start out, and then for the amnio I put in 1,500 because that's kind of what we charge. So that was my MVP patient. I'm not sure if she'll decide on that treatment, but that's kind of recommended non-surgical treatment for her. Anyway, let me know if this helped you out. Any questions, send me an email down at podiatrypracticemastery.com. Okay, until next time, thanks.